the dead of night, a nurse helps a mother deliver a baby using only the light from her phone. This is a familiar story for mothers in Karamoja. The region, located in the northeastern part of Uganda, has been plagued by insecurity, famine, and poverty. With a nomadic lifestyle, the 7 districts of Karamoja have had a long journey to economic and social development. Over the years, several organizations have intervened to come to the region's rescue. Amongst those is CUAMM.
CUAMM is an Italian NGO, a faith-based organization. The headquarters is based in Padova, North Italy, but we have a very long presence in many sub-Saharan African countries, like Uganda, for example.
Founded in 1950, Doctors with Africa, CUAMM, is one of the leading non-governmental organizations working to protect and improve the well-being and health of vulnerable communities in sub-Saharan Africa.
So we are trying to strengthen the district health systems in Karamoja so that they can be able to provide services for mothers and children that are necessary to improve survival.
In partnership with UNICEF and the Ministry of Health, CUAMM started a project to strengthen healthcare service delivery for the mothers and children of Karamoja.
This project started with a situation analysis where we did an assessment of the district health systems in all the 7 districts. There was a team made up of CUAMM, Ministry of Health, UNICEF, that went out to try to look at the challenges that are affecting the district health systems to deliver for mothers and children in the region.
Ministry of Health works with partners largely to improve health service delivery. And one of our partners has been UNICEF and the CUAMM project in Karamoja area. So what the ministry is doing to support the project is firstly by involving the CUAMM project management team into the national MCH cluster. This is the cluster that deals with all technical maternal and child health projects that we pass out to the district. So by involving them here, then that means they already have the national perspective that they can trickle down to where they are going to work.
CUAMM's mission was clear. Through strategic partnerships, they were to improve the utilization of maternal and neonatal health services in the 7 districts of Karamoja.
With all these characteristics around poverty, including poor education, lack of transport and social amenities to get women to facilities, the utilization of these crucial services were extremely low.
In the delivery sector, the mothers preferred delivering at home because they were in the comfort of traditional birth attendants. Our people have some traditions which they want to adhere to. And for them, they believe it fully, that when you don't perform those, I think the child will grow weak or something like that.
A naming procedure, for example, for children happens right at the time of birth, at the time of the first breastfeed, and it has to be done by a senior woman.
The cultures were one barrier for mothers to access maternal health, but from 2013, we saw some improvement in maternal child health activities. That is the time when CUAMM came in and brought us many other innovations that helped us to ease in work.
The birth cushion would allow mothers to give birth while squatting, as is done in their culture.
When the innovation of a birth cushion came, we took them through the birth cushion. We told them it's an alternative to squatting. Instead, it is helping you retain your energy on your knees. So by sitting on the birth cushion, it is even soft, and you have the supporters, you can just push easily, and your baby lands on a cushion. So they've come to learn that the health center is changing from the strict positions, but with all options that they are given in the labor room, they were now free to come and deliver with us.
The birth cushion is one of the innovations that have increased facility deliveries from 18% to 54%. CUAMM further procured and supplied health centers with delivery equipment, portable solar suitcases that enabled night deliveries and got maternity wards out of the dark.
There were challenges of lack of transport. You know that Karamoja is so vast, and the distance between homes and health centers is so great. A sub-county in Karamoja might be the size of a district in other parts of Uganda. And so movement of women from home to the facility was a challenge. At that time, there was even insecurity.
To curb the transport challenge, CUAMM introduced a cash voucher system for delivery and referral patients.
This is a scheme which gives riders, local riders, cash. Rather, they give them coupons, and then they transport this mother to the health unit. And from there, they bring the coupons, and they are refunded their what? The money they use for the fuel and whatnot.
I'm called Ibuka Andrew. I'm a border man. I've got several. I'm now appreciating this program because I'm also getting some money. Even though I'm the one who's fueling the picky, but at least after a month I have to get something. Even though I don't have these other customers, I have to go to villages to move just like that. I have to fuel, then I move around. When I get any lady on a pain, I have to carry.
CUAMM people have supported in such that when these transport vouchers are here, we book these mothers, we educate them that when you are in labor, not only in labor, in any condition which needs immediate attention and any emergency, get any border, let the border bring you up and attend to.
Mamparang tungani ni abeti to kono we yala ngaren kut abu angari medeke wala nyarta ya be shay viva na tungna la karango no we ngipeyo tala karta anko dina de no gono we karu ngatang na CUAMM ka pe ka ngule ponta na weda ationa yo ngatara lo munikinga na itani potanga na dia patanga na dia katatama ko re bunya ro ngata na CUAMM morkin ka na ka da papata katatama yo ara na beta miadakin uriata na re.
Mother-to-child transmission of HIV, you know, is the second most important mode of acquisition of HIV, okay, after sexual or heterosexual sex, as you've heard. Now, the country or the health sector has a very strong program and intention to really eliminate this transmission of HIV from mother to child. And Karamoja, like other regions of the country, had to be supported to drive this strategy forward. And CUAMM with UNICEF have been in the front line of addressing the challenges in the system that would make mothers that are HIV positive able to be identified, able to be put on treatment, and their babies tested and put on treatment.
Mimi kwa majina naitwa Adonyo Kadimala. Mimi kabla sijaanza kupata dawa nilikuwa na uoga zaidi kuhusiana na nini? Virusi ya ukimwi. Lakini ambapo wakati imefika nimeshazaa mtoto mmoja akiwa ako positive. nikawa bado niko na nini na hofu kwa roho yangu, sina furaha. Mimi mwenyewe najificha, niko na stigma. Yani kila mmoja akiniangalia naona sasa niko ni expose kwa watu. Pata mimba ya pili, kaja kwa hospitali. Hapo kwanza pia nina uoga zaidi. Kapewa mawaidha na manases, wakatulink kwa watu ya FSGs. Tukaendelea monthly meetings, tukijaribu ile tufanye nini? Kuwa pamoja, kutoa uoga kwa roho. Ingalao bado kuna wenye wako na stigma. Zaidi yetu tuko tumejitolea, tumetoa nini? Uoga. Na hiyo yote kwa care ya nini? Ya CUAMM. Kutuweka kwa FSGs, Family Support Groups.
And these are groups of women that came together because of their HIV status. And as members, they supported each other to fight stigma, okay, that people naturally get when they are identified to be HIV positive.
With village health teams, peer mothers groups, and other community-based groups, CUAMM has encouraged sensitization on health issues to maintain an informed Karamoja.
Through the help of VHTs, the community is now trying to embrace health service program because the VHTs help in sensitization, the benefits of accessing health services. So, CUAMM also is supporting VHTs to sensitize community to come for health services within the district. And at least they have improved. They can come for antenatal, they come for delivery. As well, they even come and bring their children for immunization. And they are trying to bathe also. You can see they are smart.
In the past, it was about the mother and her womb and her child. These days, through engaging the male partners, they accompany their wives, pregnant wives, for ANC services. They accompany. Even visiting for counseling purposes, they now accompany. But in the past, they were resistant.
The maternal neonatal effort or the maternal child service improvement effort in Karamoja is certainly also contributed by a number of other implementing partners. And I must say that we have benefited from their complementary effort. And we thank them for this complementary support that they are giving. Of course, including their main donor partners. USAID, for example, has two big projects that Concern and Mercy Corps are implementing to support some of these improvements that we are observing.
We really thank our implementing partners, and we really encourage them to continuously work with the Ministry of Health, especially on standards, because we've also had challenges managing partners. Some days they are not aligned to the Ministry of Health protocols, but we are happy that CUAMM and the UNICEF project has really tried to align into the national agenda, and we hope that this can help us to improve the service delivery nationally.
And of course, we have to thank the donors who finally made this money available to UNICEF and to us. And the current support for maternal neonatal health is from the Korean agency COICA, but we also have supplementary support from SIDA, especially for the HIV-related activities, and support from DFID for the nutrition-related activities. And we are very grateful to these donor partners for making this happen. But I'm proud to say that I think all these people I've named must be happy for the changes that have been observed in Karamoja.
Jamaye, away jamamuye, jamamukulo, jamaye. Jamaye, 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 abaraku amanyitumo tolo tolo da gitara kala takizingi yokode yatala tanakizi yokode yajokala tanakin yokode kotere itanere yokode kotere tudomere yokode kotere chipipio yokode itota natulei abaraku amanyitumo tolo tolo da gitara kala takizingi yokode yatala tanakizi yokode tapatana kitano yokode tapatana tobiomio yokode tapatana romita yokode itota modi abaraku amanyitumo tolo tolo da gitara kala takizingi yokode yatala tanakizi yokode tapatana kirumi yokode tapatana tobiomio yokode tapatana romita yokode ikitanya beranya beye iyo naleyo ayaku amanyagiyana nakaya iyo naleyo ikitanya beranya kokor iyo naleyo ayaku amanyagiyana nakaya iyo naleyo ikitani kokanya kala iyo naleyo ayaku amanyagiyana nakaya iyo naleyo ikitanya beranya iyo naleyo ayaku amanyagiyana